I'm Professor Bola Owolabi, Director for NHS England's National Healthcare Inequalities Improvement Programme. Turning the Tide is a collaborative effort to demonstrate that coastal communities such as Clacton-on-Sea can make significant progress in the biggest health and healthcare challenges that they face, and that we can achieve that through partnership and collaboration. So today is very much about turning the tide on siloed working, turning the tide on the challenges that we face, and turning the tide towards progress rather than simply admiring the challenges that coastal communities face.
How important do you think the ICSs are, the integrated care systems are, towards making the changes that are needed with this?
I mean, the integrated care systems are such a tremendous opportunity. We know that when the ICS white paper was published, there were 4 aims of the ICS in that paper. And aim number 2 is to reduce inequalities in access, experience, and outcomes for their populations. And so for me, the fact that one of the 4 reasons why ICSs were created in the first place was to tackle health inequalities is incredibly powerful. The second reason why they are such an opportunity is because they bring the system together. The NHS, the local authority, voluntary sector partners, our people and community themselves. Because the solutions to the long-standing challenges of coastal communities don't sit in one individual organization or one individual sector. It's the intersection of the efforts of many actors coming together into a coherent whole. That's the path forward, and that's why integrated care systems structurally and functionally give us the greatest opportunity to make progress in this area.
So organisations coming together locally, but also coastal towns coming together, because there are very many common problems that exist from one coastal town to another. Is that right?
Certainly. So the Chief Medical Officer for England, Professor Sir Chris Whitty, in his Coastal Health Report 2 years ago, demonstrated clearly that whilst coastal communities have their differences, actually in terms of the challenges they face, there are significant commonalities. And within those commonalities lie opportunities for collective action and collective interventions, because it means that coastal communities, coastal integrated care systems can come together around their common difficulties, around their common challenges, and coherently formulate similar opportunities for progress, strategies, interventions that work across the commonality of those challenges. So that's another opportunity that the integrated care systems, particularly those that serve coastal communities, present.
In terms of measuring success and evaluating turning the tide, what does success look like? And have you got an idea in terms of timescale that you're looking to make those changes by?
So our North Star is the government's published ambition in the Levelling Up White Paper, which is to narrow the healthy life expectancy gap between the richest and the poorest areas by 2030, and to increase overall healthy life expectancy by 5 years by 2035. Those are stretching ambitions, but I'm confident that as we work together with our coastal communities in particular, we have a fighting chance of achieving those objectives, because the biggest gains are at the margins. Our opportunity to achieve those North Star ambitions lie at the peripheries. Our coastal communities offer us a great opportunity to accomplish those published government ambitions.
And here in Clacton, an exciting prospect for the local community here, would you say?
I think it's an exciting opportunity both for the local community because of the traction that we're already gaining, the progress we've made through the Health and Care Academy model, the peer researcher model, but even more importantly, the exciting opportunity that we have that Clacton-on-Sea is now convening other coastal communities to come together and coalesce around that shared purpose of narrowing the health inequalities gap. That is the wonderful opportunity that we have, and it's incredibly exciting to see it.